Alright, so here is my PowerPoint presentation, and the topic I chose was suicide. And here's just some brief overview of suicide. It's the 18th leading cause of death in the world. Over 800,000 people die each year from suicide, and that accounts for one person every 40 seconds. And those rates continue to increase every year. And suicide affects more than just the people who commit. Almost every person can relate to suicide in some way, whether been a family member or a friend that's committed suicide or suicidal thoughts themselves. Common issues like depression and stress are leading factors that contribute to suicide. It's controversial for many reasons. It does involve violent behavior towards oneself, and issues that lead to suicide can include depression, drugs, financial crisis, stress, loss of a loved one, or mental disorder. Culturally, opinions about suicide are different. Some cultures praise the act, while others condemn it. And assisted suicide is also a controversy worth mentioning. Just some questions about suicide. What are the leading factors that contribute to suicide? And what interventions or coping strategies are most effective in preventing suicide or suicidal thoughts? And here are just two experts that I've just made up. We got Dr. Alan Johnson here. He's worked in the as a clinical psychiatrist for the past 27 years, working with individuals from all backgrounds and ages. He was awarded the McGavin Award for Distinguished Career Achievement in Child and Adolescent Psychiatry for his work with children and adolescents. And then we have Mariah Fritz here. She's a school counselor. She's been with North Sioux High School for the past 8 years. Before that, she worked at various treatment facilities helping adolescents cope with drugs, alcohol abuse, depression, sexual abuse, neglect, and behavioral issues. And science and the understanding of the human mind has come quite a long way since it first began. Psychiatrists like Dr. Johnson apply coping strategies and interventions that have been shown effective in combination with pharmacological therapy. Dr. Johnson depends on psychological research so that he can continue to improve his practice. Suicide is most common among those who have suffered a recent stressor, had a previous suicide attempt, failed to achieve something, have lost a loved one, or are living with a mental disorder, or have substance dependence. And PTSD is a major mental health risk for military veterans. It's the 10th leading cause of death in the United States, and veterans have a higher risk of suicide rates, and approximately 22 veterans commit suicide every day. Psychological research has found that the rate of suicide decreased significantly for veterans who had used VHA services, while it spiked for veterans not using those services and increased for non-veterans. Medical professionals provide a wide range of services which include surgery, critical care, mental health care, pharmacies, radiology, orthopedics, and physical therapy to help veterans who have PTSD and maybe thinking about suicide. And moving on to Dr. Fritz. She works more closely with adolescents and young adults who are experiencing social and emotional difficulties or who may need help to reach academic achievement. She helps students and possibly even staff cope with stress, anxiety, depression, and suicidal thoughts. In comparison with a psychiatrist, school counselors encounter suicidal patients more often than they do. In fact, many psychiatrists will refuse to see patients who are suicidal just for fear of legal issues and things like that. School counselors, they'll work with teenagers at some of the most stressful times of their lives when they're trying to figure out who they want to be, the people they want to associate with, career paths, goals, how to accomplish those goals, and all while taking on more and more responsibilities. The stress and anxiety can lead to depression, which may further worsen the incidence toward suicidal thoughts or attempts. And according to a 2010 Centers for Disease Control and Prevention study, 13.8% of American high school students had seriously considered suicide in the previous 12 months, and 6.3% reported having attempted suicide during that time. School counselors are often one of the first lines of defense that adolescents, young adults will go to in dealing with their suicidal ideations. Students may confront their counselor because they don't feel comfortable talking about it at home with their parents or siblings, or because the problem is at home. And counselors have resources that they can refer to and have a high standard of training in suicide prevention. And counselors can assess student suicide risk and take the necessary approach to help keep the student safe by contacting parents, caregivers, and colleagues if necessary. And just a comparison of the two views. Obviously, both believe that suicide is preventable with the right interventions for that person. Psychiatrists like Dr. Johnson rely on multiple treatments, including pharmacological therapies. And Mariah Fitz, she specializes in assessing suicide risk for young adults and adolescents. And she has resources like working with parents, caregivers, and colleagues and such. And that's the end of my presentation. I hope you enjoyed it.